Today, we are going to talk about intellectual disability. When you're evaluating a child or an adult patient who comes from a group home setting, you want to think about possibility of intellectual disability if the presentation um, validates that. So usually it's diagnosed in childhood, and deficits in intellectual disability are reasoning, learning, and problem solving. And it also impacts the daily functioning, such as social skills and independent living. So, to diagnose IDD, you need an intellectual testing, IQ testing, and based on the scores, they're divided into mild, moderate, severe, and profound. So, when you look at the severity levels, the mild is 50 to 70, the moderate is 35 to 50, the severe is 25 to 35, and profound is below 25. You also want to know, like when you evaluate a patient, if you see somebody with concrete communication and can benefit from supportive employment, this is mild. And somebody with limited verbal skills, he may need specialized day programs, that's moderate. And somebody with severe will be having a very limited verbal capacity. Profound will require assistance for all tasks. So now, what are the effective assessment approaches? Talk to patients directly, they understand more than they may express. Match their communication style based means like if they're using one word or two word sentences, try to understand the use of language and try to communicate with them in somewhat similar vocabulary so that they can understand. Using cross questioning techniques means like if you say something and they feel they don't understand, you can try to um, change it in a way that they could comprehend better. Avoid multiple choice or double barrel questions. So you want to keep the questions simple. And you can use like birthdays and holidays about to ask about historical events because they may not able to comprehend otherwise. And in this population, if they are aggressive, you can try medications such as Abilify, Geodon, Zoloft, Lexapro, and also Depakote and lithium. And also you want to look at like emotion regulation skills training and things like that. A lot of times, what I do when I'm evaluating is, let's say that the patient presents with aggression. My goal is to understand, like, I'll get history of these episodes, and then I try to get like maybe 1 month to 2 month history and get a sample size of 5 to 6 episodes or events when this aggression is happening. Then I try to understand if these episodes seems to be related to ADHD or seems to be related to ODD or related to anxiety or mood disorder or any other things. So once I have the sample size of the symptoms history and the events, I try to tease it out to see if the underlying driving cause is any of this. Then I try to think about solutions, both non-pharmacological and medic pharmacological mechanism based on the driving issue which is going on. So if ADHD, you can think about stimulants, clonidine, guanfacine. ODD, mainly structure and behavioral management. Anxiety, a low dose Prozac or Zoloft. And mania, or if you think that the patient falls into the bipolar spectrum, you can think about Depakote, lithium, based on their liver function test and renal function test. So just wanted to give you an overview. Intellectual disability, I think it's important to understand the IQ range and based on the range, how they are adapted. sometimes you have somebody with an IQ range which is lower, but their adaptability is better. So you want to think about adaptability and functioning, about what they can do and how you can support them. I hope that helps. Thank you.